it has shown several thoughts that we had understood later how important they were, not discussed yet then 33 years ago. For example, that the disease starts much earlier than we see clinical signs. I think it was first time when it was called like early biomarker. Now it's very usual to talk about because quite a lot of research is done on namely early biomarkers that might lead us to diagnosis before the clinical symptoms start. But he did it already in 1992. Key message is prodromal disease. Now it's quite often used and we have even guideline for prodromal disease. But then it was something very innovative because diagnostic criteria are about physical or motor symptoms, but to talk about early disease or prodromal disease because clinical manifestation was something very innovative. Another was time of diagnosis during this course. We know by now that Parkinson's disease starts much earlier, and it was maybe some kind of first notice that actually we have a delay in diagnosis because we don't see these signs when actually Parkinson's disease starts. And one more thing I think it's very important is young Parkinson's disease. Now we know about genetics. We know several causes additionally to genetics, such kind of environmental factors and so on. But then young Parkinson's disease was not in focus in this way like now. And we do now genetic panels for early disease patients. But now we know much more and we know when to think about early and genetic causes. So it was one of these key messages for us, even nowadays. It was anyway something that has led us to these criteria that we know now, that are in use now. I think that also such kind of articles that describe something and discuss about the signs that have been described might also be important because following the patients during the course and recording their signs and their own descriptions and also videotaping might give us new clues that give us additional information about the disease in broader way. This discussion is very interesting. It is not just case presentation. James Parkinson, his publication essay on the shaking palsy was based in 6 case presentation. And he also made such kind of conclusions on this. And I think that this article makes the same. Describes patient and make conclusions about early diagnosis earlier than it is in clinical science. I think it is something very important.